Good morning, everybody. It's Dr. Galvin with another update after a night shift in the ER. Worked a couple nights this weekend. Things I've alluded to yesterday have changed. We're not seeing as much COVID, although last night it seems like we saw a lot of COVID again. I only think we had 2 COVID patients in the department the night before last. Last night, I think we had maybe 10 or 12, and a couple of them were pretty sick. As usual, all unimmunized. We really don't see that many sick people who are immunized. It's the unimmunized ones that seem to be having the most problem. The biggest problem is that this is sort of the beginning of the winter, and this is the time that the hospital gets busy. And with the staffing shortages I've also kind of talked about, it's becoming increasingly difficult because there are no staff to take care of patients, which means they back up. And in the case of the emergency department, it means that instead of admitted patients being removed from the emergency department and sent up to a floor bed, they stay there. And if that patient is in my ER bed, I can't use that bed for anybody else. Not only that, but now that patient has to be cared for by an emergency nurse who can't care for an acutely ill person, is now stuck babysitting somebody who should be admitted on the floor where they're sort of set up to do that. And our nurses are not really, that's not their interest in doing that kind of care. That's why they work in the emergency department. And none of us are particularly good at it. It's not good care anywhere around. It's not good for the patient. It's not good for us. And it's difficult. The other thing is that this is the time of year that cases in the hospital we start seeing lots of medical problems at this time of year. And it seems like the people we're seeing are much sicker this year. I think that's in part because people have been ignoring their health because of the pandemic. And it just seems that the people we're seeing are sicker and sicker, that require more and more care and more effort and everything else. And it's just this compounding problem it makes it really tough to work. And then patients are unhappy and you get yelled at for things that are completely out of your control, and you try to be nice about things, but it breeds a lot of frustration, and it makes it difficult. I wanted to talk a little bit about, we talk about things to avoid COVID all the time. We talk about masking and distancing and immunizations and things like that, doing things. As I've oftentimes told people, if you get COVID, you're rolling the dice, and about 50% of the time, it ends up with something you don't want. So about 50% of the time, you end up either with long-term COVID symptoms. 20% of the time, you end up really, really sick for a week, 10 days in the bed, sick as you've ever been. 5% of the time, you end up in the hospital. 1% of the time, you end up dead. So about half the time people get COVID, it ends up being either a prolonged issue or them being really, really sick in one manner or another. And so you just don't want to get it. And we've talked about the things to mitigate, avoiding crowds, trying to avoid people who are sick, staying home if you're sick, getting immunized, which will protect you from the most serious side effects of COVID. But, there are some underlying things that I talked about yesterday that really seem to be common. And one of them is obesity. And obesity markedly increases your risk of developing those more severe parts of COVID. So if you're perfectly healthy, you get infected, you roll that dice, you got a 50% chance of having a problem of some kind, either long COVID or being really, really sick. But if you're obese, that risk goes up by another 60%. So it's very, very significant. And what has happened, if you look at the data of obesity in the United States, and I think it's mirrored in many other countries, since the pandemic started, obesity rates have jumped significantly. There was a survey I saw recently, I'll see if I can find it and put a link to it, that they did just a phone survey of a couple thousand people, and they asked about weight gain during COVID. And the average of that survey was 27 pounds. And realize that we have an obesity rate that's quite high anyway. It was 42 to 45% pre-COVID, and we think that those numbers have jumped significantly over the last year and a half, 2 years with lockdowns and just all the stress and everything else that goes into COVID. So I'm not going to really delve into obesity on today's talk, but I think over the next couple of weeks, I'm going to do a series of videos about obesity. In my other world, when I'm not working in the emergency department, I'm the founder of Vitality Medical Wellness Institute, and we really work to optimize health. And a big part of that is optimizing physical performance. And in many cases, that means losing weight. And we have a very, very effective weight loss program. But there's a couple things that I teach my staff that we don't do. We don't do diets. We don't do rapid weight loss. And we try to maintain the joy in life. So that means that we've got to give people delicious foods that they enjoy eating so we don't steal their joy. And we need to do it in a way that's consistent over time, and it really is focused on lifestyle change. And consistency plus time begets results. And the fact is that restrictive diets almost never ever work. And we're going to talk a little bit about the science behind that, and also we'll talk a little bit about other things you can do. There are biohacks and other cheats that we use in the clinic all the time, be it intermittent fasting or medications or journaling or any of a number of different things that can help you on your own journey for weight loss. And I think that will be sort of the topic I'll be covering over the next month to 2 months, to try to give people some more tools. Again, because if you meet the definition of obesity and you can reduce that, if you do develop COVID, your chance of having problems are much reduced. I'm exhausted. I'm going to go to bed now, but I will work on these obesity and weight loss videos that we'll be posting both to YouTube and to Facebook. My name is Jeffrey Galvin. I'm a board-certified emergency medicine and functional medicine physician outside of Charlotte, North Carolina, and I've been posting these videos for a while. If you like it, please subscribe to the YouTube channel or follow us on Facebook and hit that subscribe button. Have a great night. Protect yourselves. I'll talk to you soon.